afternoon and thanks for joining us. I'm Judy Simpson. According to the American Cancer Society, every woman is at risk for developing a gynecological cancer, and the risk increases with age. Each year there are about 98,000 new cases diagnosed and about 30,000 deaths from gynecological cancers. To find out more about the risk, prevention, and treatment of these cancers, we've called on an expert from the University of Vermont Cancer Center. Joining me is Dr. Elise Everett. Dr. Everett is a Cancer Center member and a professor in UVM's Department of Gynecological and Reproductive Services. Thanks so much for being with us.
Thank you.
So what types of cancer are we talking about?
So when most women think about gynecologic cancer, they think about breast cancer. And that's because it's the most prevalent cancer of the women's reproductive tract. But there are actually 6 other gynecologic cancers that also affect women. So if we think about the female anatomy from the outside in, there's vulvar cancer, which is a cancer of the external genitalia. There's vaginal cancer. There's cervical cancer, which most people are familiar with because that's what pap smears screen for. Mm-hmm. And then there's uterine cancer, or cancer of the womb. And then there's ovarian cancer and fallopian tube cancer, which are really thought to be one disease process.
And so how common are these types of cancers?
So breast cancer, there's about 250,000 new cases every year, and that's what you hear the most about. But the next most common gynecologic cancer is actually uterine cancer or endometrial cancer, and there's about 50,000 to 60,000 new cases every year. And then ovarian cancer is the next most common, and that's about 25 to 30,000 new cases a year. And ovarian cancer is really probably worthwhile to discuss because it's the most deadly of all of the gynecologic cancers.
Well, let's talk about that then. How does it manifest itself? What to look for? Are there tests, to see if this is something that you're suffering from?
Yeah, so one of the problems with ovarian cancer is that there is no screening test, and this is a pretty common misconception from patients and even from primary care physicians. So a lot of people feel like an ultrasound will pick it up, or a blood test called a CA-125 will pick it up, and they feel like they should be getting these tests, or their primary care physician should be ordering them, but we really have no scientific data to support them as a screening tool. So unlike mammograms that screen for breast cancer, we don't have a screening test for ovary cancer. The other problem with ovary cancers is, unlike your breast where you can maybe feel a lump, they're internal organs, and the symptoms of ovary cancer are really vague. And so there's symptoms like feeling full early, where you can't eat a full meal, or having abdominal bloating, or maybe having changes in your bowel habits. And so most of those symptoms will make women think about something in their intestinal tract.
Right.
And not think about their ovaries. And so the symptoms are really vague. And so what unfortunately happens is we tend to catch ovarian cancer very late rather than early, and that makes it very hard to treat. And our outcomes are not as good as we would like, I guess.
Yeah, I think we have a slide that we can show that sort of illustrates some of the different cancers and also what to sort of look for. And, these are, looking at those symptoms, it could really be anything.
Yeah, so the real key with symptoms is to have a good understanding of what your baseline is. So knowing what's normal for you, knowing what's normal for your bladder habits, knowing what's normal for your bowel habits, knowing what's normal for your menstrual cycle. And really what we want to focus on is a change from normal. So something that's new, not something that's chronic that you say struggled with all your life. A lot of women struggle with constipation. We're not worried so much about those chronic issues, but we're worried about a new symptom, so something different from your baseline. And then when cancer arrives, it's a permanent thing until it's treated. And so if you develop a cancer, that symptom's going to stay with you. So it's not something that's going to just come and go, like if you ate a bad meal the night before. Mm-hmm. It's something that's new, and then it's going to persist over time. And so we want a new symptom, something that's maybe there more than half of the days of a month, and then something that persists over several months would be symptoms that we'd be worried about. And then that would be an opportunity for you to call your primary care physician and seek a consultation.
Mm-hmm. So what do we know about the causes of these kinds of cancers?
So cancer at its very core is caused by a mutation in the genes. And you can develop these mutations in really two different ways. One way is you can acquire them from the environment. So smoking can cause damage to your genes. Estrogen can cause damage to your genes. HPV, the human papillomavirus, can cause damage to the genes. Sunlight, so like melanoma and skin cancers, that can cause damage to the genes. Radiation therapy for treatment of something else can cause damage. So you can acquire them through the environment, and those mutations that develop then allow the cell to sort of grow unregulated and multiply, and that's ultimately what cancer is. You can also inherit them. So the two most common inherited sort of cancer syndromes are the BRCA syndrome, which puts patients at risk for breast and ovary cancer. And then there's Lynch syndrome, which puts female patients at risk for colon cancer, endometrial or uterine cancer, and then ovary cancer.
Should you be tested for these things?
Yeah, so it's really important as a patient that you know your family history. So, and when you go in to see your primary care physician, they should be taking a very careful sort of family history about who in your family has cancer. Are they a first-degree relative or a second-degree relative? How old were they when they developed the cancer? So that should be part of your medical record. And then they should also be taking a history around, do you have risk factors for these certain cancers? And then your primary care provider can assess whether or not they think you're at an elevated risk, and then they would refer you on for genetic testing.
Mm-hmm. And so, are there any misconceptions about gynecologic cancers?
I think one of the biggest misconceptions is that somehow we have a screening test and we should be catching all of these really early. And like we spoke about earlier, for breast cancer, we do have a screening test, and that's the mammogram. For colon cancer, we have colonoscopy. The only two gynecologic cancers that we have screening tests for are vaginal cancer and cervical cancer, and that's the pap smear. But for vulvar cancer, for uterine cancer, for ovary, for tubal cancer, none of those cancers have a screening test. And so we rely on patients to report symptoms and report genetic risks or exposure to risk factors to try and identify cases.
And it's up to, the individuals to be persistent about contacting their doctors.
Absolutely. I think the key is really education. So, educating patients about, making sure they know their family history, educating patients about risk factors and things that they can do to decrease their risk, educating patients about normal, because you have to know what normal is to understand what abnormal is, and then really making sure that, patients are utilizing the healthcare system and presenting to their primary care physicians.
How do you know if it's something unusual or just part of aging?
Yeah, so that's a common problem. So the best example I can give is with uterine cancer, where the symptom is really bleeding. And so most women sort of think that that's sort of part of being a woman. They're like, well, we have menstrual cycles and bleeding is normal. But bleeding really is only normal up until about the age of 51, which is the average age of menopause. And then bleeding after that age is very abnormal. So any bleeding after menopause should be immediately reported to your physician. Where we tend to miss people is in that sort of age of 45 to 55, where people are perimenopausal and they're starting to have irregular bleeding. And so again, if you have a change in your bleeding, and so maybe you used to have a menstrual cycle once a month and now you're having 2 a month, or you're having 1 every 3 months and they're really heavy, that's a change from your normal, and that should be reported to your doctor.
How can we be proactive about prevention and detection?
So again, I would emphasize that I think education is the most important way that women can be proactive. I think understanding your female body and what normal is, I think understanding your family history and cancer risk is important. And I think, understanding what risk factors that you can alter in order to decrease your risk of cancer is important. And so these things you can get through, speaking with your primary care provider. There are lots of resources online that you can use. And then to make a plug for our upcoming conference, once a year here at the University of Vermont, we do the Women's Health and Cancer Conference, which is a full day event with 80 sessions. It's free. It's aimed at a really wide audience of patients, family members, general public, providers, and it covers a really wide range of topics from just basic women's health care to aggressive cancers.
So if someone is diagnosed, what are the treatment options?
So for gynecologic cancers, the treatment options are really, you can choose to do nothing. That's always a choice, not usually the recommendation, because these are very treatable. Often there's surgery plays a role, particularly if we catch cancers early. There's a role for surgery to remove the cancer. And then there's often a role for radiation therapy and or chemotherapy. And if we catch cancers late, then we're more often to recommend chemotherapy plus or minus radiation therapy.
And so what services or treatments are available to Vermont women through the UVM Medical Center?
So I think, Vermont's a smaller state, and so I think sometimes people have the misconception that maybe they can't get everything they need here at UVM Medical Center, and that's, not true. We have a full ability to provide all the care necessary to treat gynecologic cancers through our division of GYN oncology, our division of surgical oncology, radiation oncology, and medical oncology. So we can see a patient, do a consult, do the operation, provide radiation if necessary, provide chemotherapy if necessary, and then we also do end-of-life care. And we have a very active clinical trial program. So if patients, meet criteria and need access to sort of cutting-edge clinical trials and new targeted therapies and immune therapies, that's all available at UVM. So they can receive the highest standard of cancer care right here in Burlington.
What else do you want our viewers to know about?
I think, again, the emphasis would be on education. And I think this conference on October 7th is a perfect opportunity to come and really learn about what's normal and learn about how important family history is, learn about the symptoms to look for, and if you have those symptoms, how to access the health care.
I think one of the problems with these kinds of cancers is it's not really easy to talk about some of these things. It's, change in bowel habits. Well, I'm not going to talk about that.
Yeah, it's absolutely true. So we kind of need to work together, I think, as a community and as women to be okay with talking about those things. Working with the medical students, I would say that the younger generations are much more open about talking about these things. So I think things are changing, but unfortunately most of the women who get these cancers are older, so they're more in the 50 to 60-year-old range, and they're less comfortable talking about these issues. So I think on that end of things that it's the provider's responsibility to not be afraid to ask and try and establish a trusting relationship with your patient so that they feel comfortable talking with you about those more sensitive issues.
Any advice you'd give for folks who are maybe watching this program and think, maybe I do need to find out more? Should they immediately call their physician?
Well, I think there are lots of resources, and so again, I think starting with a little bit of just basic self-education is a good place to start. If you are getting lost in the internet and all of the information and not sure what's right and what's wrong, then I think your primary care provider can be a really good source, either to direct you to good sources of information that are available on the internet, or to give you pamphlets which are available in the clinic that are vetted through the things like the NCI and things like that. But also just to have a conversation with your doctor.
And then once again, the annual Women's Health and Cancer Conference, which is Friday, October 7th at the Sheridan Conference Center in Burlington. You can find out more by going to the website. I want to thank you so much for joining me today.
Great. Thank you.
That's our program for today. Thanks for joining us. I'm Judy Simpson. I'll see you again next time on Across the Fence.